Assalamu alaikum. Good evening, my fellow Pattersonian and my fellow citizens. My name is Dr. Daniel HUQ. I'm a medical graduate from St. Kitts Windsor School of Medicine. I'm also a registered nurse, and I have a degree in advanced practice nurse as well. Currently, I'm an adjunct professor at William Patterson, and many of you know me from doing community public health fairs. I try to get people involved in getting our community enrolled in healthcare in terms of early detection of hypertension or diabetes. As you know, currently there's a big crisis going on in our society in terms of coronavirus, also known as COVID-19. Uh, there's a lot of information out there. I just wanted to give you some feedback of what I know currently, working in two different hospitals and from my own personal experience. I just want to give you what I know and what's going on, so that way you are aware of what's going on and be current with the information. As you know, things are changing rapidly. Initially, when we're told in terms of about this infection, that mostly elderly and people who are immune compromised were at risk. But now we're finding out that younger people are also at risk. So as you can see, this virus is affecting many of us, and we're forced to, currently our governor had declared state of emergency. Many of us are in our indoor. So I just wanted to let many of you know what I know currently. Again, if you need updated information, the best source for you would be CDC. Don't rely on your neighbor or some other people or somebody saying take this, take that, it's going to help. At the end of the day, CDC, which is known for Center for Disease Control and Prevention, they are the most up-to-date information they have. This is the reliable source as of now. I know a lot of us are within our household, with our families and our children, and the question comes up in terms of how do I keep myself safe. One of the things that has been told many times is social distancing. What does that mean? It means you keep yourself isolated or separated from other people. Currently they said 6 feet from the other person. So again, I know because a lot of people, especially in our community, we have this desire to see other family members because now we're not at work and other what have you. Please don't do that. You are not helping yourself or anybody. Yes, you may feel fine, you may be asymptomatic, or you may not have the diseases, but we don't know if you're a carrier. So if you're a carrier and you see somebody like grandma, grandpa, dada, dadi, nana, nani, or chacha, chachi, somebody who's elderly, you can pass that on to those people who are immune compromised, who are elderly, who are, it's going to affect them worse than anybody else. So yes, you want to see a relative, let's wait. Call them on the phone, do a video conference, do talk on the phone. But the other thing you got to also worry about is keeping yourself clean and your family members clean. One of the things that we talk about is hand hygiene, which is washing your hands, which is, again, you got to wash your hand thoroughly, at least 20 seconds. That doesn't mean you do it for 20 seconds, do it for 30 seconds. It's not going to hurt you. It can help you. And whenever you cough in your arms like this, so that way you're not spreading the germs. You can wash your clothes anytime, but if you pass on the germ to somebody, you're putting somebody at risk from being intubated to cause of death. As you know, we're still learning a lot. So let's take the precaution and be safe for everybody, not just for ourselves, for our loved ones and our neighbors, our family, everyone in the society. Sometimes you may feel like, well, it can't happen to me. It may not, but you may be a carrier that can give it to somebody else. The other thing I wanted to address is sometimes you're concerned about what's the difference between that and flu. The symptoms are very similar, except that when it comes to coronavirus, they talk about you having high fever and shortness of breath. So sometimes, as of now, we don't have a treatment for it. So again, it's symptomatic treatment. So a lot of times people want to rush to the ER, which is emergency room. You don't want to do that because let's say, for example, you don't have the disease. Now, by you going there, you are more likely to get it because there are people in the hospital that are currently admitted with coronavirus, and it's the area of high infection. So at this time, my advice to you, and the advice that's given by many doctors, including from CDC, is that call your doctor. Do a video conference, a telemedicine. Talk to a doctor, somebody who's going to give you proper directions what to do. Uh, and most of the time they'll tell you keep yourself isolated. Again, 6 feet from the other family members. Clean your surfaces and your sink and your toilets and things like that, so that way you're not passing on the virus. A few days ago they said it lasts so many days. Now it says so things change from day to day. So we're learning more, but take it upon yourself to be safe. You know, you are the best advocate for yourself. I know a lot of our people think that, you know, by praying it's going to go away. You know, Allah gave us His whatever belief you have. That's wonderful. Pray to your Creator, Allah, God, whoever you want to pray. That's great, but do it by yourself. There's nothing wrong with praying by yourself. As you can see, many religious organizations such as mosque and other things have been closed down to prevent people from gathering together. So my advice to you is that care for yourself and care for your community. Take the time to pray and do other things, but at a distance. And if you have any questions or concerns, you can reach me. My number is 973-650-8121. I have a lot of doctors friends who I can refer you to, or we can talk to you over the phone. So if you have any questions, please do not hesitate to call. As you know, our Governor Murphy had instituted drive-through screening. Currently it's taking place at Bergen County, and I'm told there's going to be several other places. I was called to come and help with that as well. And again, if you're asymptomatic, meaning if you don't have any fever or any of those things, please stay away from people that are getting screened, because you don't know. Some of them may give you the infection, so let's avoid that. If you have, again, I want to assure you, if you feel uncomfortable or if you are worried about it, call your doctor. Call the telemedicine. Let them give you the guidance. Do not go out there and expose yourself to the risk. It's not worth it. And again, one of the reasons they do that is that we do not have enough test kits to give it to people that are not symptomatic. Again, if you are symptomatic, definitely we want to take care of you. But if you're not, don't go out there and expose yourself to that. This is the current information that I have. And as time goes on, hopefully within the next 2-3 days, I'll give you an update. And if you have any questions, you can always call me, and I will try to answer that to the best of my abilities. Thank you.